Welcome everyone to our first webinar with Carolina Facial Plastics. I am very excited to be here today with Dr. Jonathan Kulbersh and with our nurse, Kathleen Summers. We are speaking to you today about hair restoration and hair loss. And this is an area of our practice. We've been doing hair loss treatments for some time now, but it's often an area that we realize a lot of people don't realize we offer. And then, but best of all, we just got a brand new device called the NeoGraft to do hair transplants. So we're excited to talk to you all about that today. Hopefully dispel some of the myths and answer some questions and help you guys get more educated on the topic. So short introductions here. We can go to the next slide. First up, we have the one and only Dr. Jonathan Kulbersh. If you don't know him, you should. He's amazing. Dr. Kulbersh is a double board certified facial plastic surgeon. He has experience with hair loss and has actually been training with hair loss since the very beginning. Even during his fellowship, he did some work with Dr. Craig Ziering. But also maybe you know him from seeing him in some of our magazines because he's won a lot of awards. He is the winner of the Charlotte Best of or Bob Awards for the best facial plastic surgeon for the last 5 years running. And we're really proud that we also won Best Medical Spa. He's also a Castle Connolly top doctor, and the list goes on. So Dr. Kulbersh, thank you. And I believe the next slide has a little bit about the practice. I'll share this and then I'll share Kathleen and then I will hand it over to the doctor. So if you're not familiar with Carolina Facial Plastics, you should be. We are located in the heart of South Park and we like to call ourselves the top aesthetic destination of the South. We have a full team of cosmetic experts. We have a fully accredited surgery center, which is actually where the hair transplants are done. We also have a private recovery retreat in our building, and we're all located, like I said, in the heart of South Park. And patients come in from all over the country and for sure all over the South. So it doesn't matter where you live. And I think what we're best known for is our natural looking results. And of course, that we focus exclusively on the head and neck. So let me introduce our nurse, Kathleen, who we love. She has been with us also almost for 5 years, which is amazing. And, you may know Kathleen or you may recognize her because she actually leads and runs our operating room. So if any of you have had surgery or come through there, you would have known her. She also is one of our providers. She does, microneedling and PRP and some laser treatments, but mostly she is our hair care coordinator. So she is your all things hair for the practice, and she's going to be coordinating all the treatments. So I will now hand it over and Dr. Kulbersh and Kathleen will share with you, and then we'll open up for question and answer at the end.
Good evening, everyone. I just want to first thank everybody for their time. I know everybody's time is valuable, and it's this time of night we're bath and kids and families, and so I certainly appreciate you being here.
Yes, thank you guys for coming. We really appreciate it.
Tonight, really our goal is here for everybody to just learn more about hair loss and your options if you're experiencing hair loss. And so tonight is going to be hopefully slightly entertaining, very educational. And so please ask questions as they come up, and we'll go through all those at the end. But just to go way back, being a facial plastic surgeon, I was doing surgeries on the face for a long time, and then I realized that I was really missing out on an opportunity to really help people because the hair is so important when it comes to aesthetics of the face and framing the face. And so really at that time, I was like, I really need to dedicate myself and really learn hair. And also I was experiencing a lot of hair loss, and I was like, I need to learn it for myself as well. So this process started about 5 years ago, and we really incorporated hair 5 years ago. And I understand that hair loss can really cause worry and stress and loss of self-confidence. And so that's why we're here, is to really help people if they want to do something about their hair loss. I always think, statistics are kind of fun and interesting, just to know that your hair has a lot of hair on it. Approximately about 100,000 hairs are on your head. Redheads, like most people on this webinar, have the least amount of hair, and dark-haired people have the most. I think one important thing to know is that hair grows in units. So every hair follicle can have 1 to 4 hairs in it. That's a follicular unit. That's important because that's what we transplant. It's follicular units, not hairs. We'll get there in a little bit. And then I also think it's fascinating. This was shocking when I first heard about this, is when you don't notice that you've lost hair, you've lost about 50% of the density of your hair. So that means when you start noticing that you have hair loss, you've actually progressed and already had a lot of hair loss already. So it's really a sign that that's probably the time where you want to consider doing something about it. Now, unfortunately, hair loss, once it starts, it never stops. So it is progressive the rest of your life. Now, how fast or how slow you lose it, that is variable from patient to patient. But I think the key thing is if you know you're going to progressively lose it, let's do everything we can to keep it we have and slow the loss that we have. Most people go through what is called miniaturization of the hair. That's what you're seeing at the bottom. What happens is your hair goes through growth phases. It grows, it stops, it sheds. It does that repeatedly. And what happens when you lose hair, every time your hair grows back, it gets smaller and smaller. That's miniaturization. And then eventually it's gone. So that's kind of how the hair loss goes over time. That's why you thin and then it's gone. Men and women have different causes. Men overwhelmingly have what we call androgenic alopecia. That's due to hormones, dihydrotestosterone, what mainly causes it for men. Women also just have natural hair loss, but the number one cause is actually thyroid dysfunction. So if you're losing some hair, the first thing I'll tell a female to do is just make sure your thyroid is working properly. Just as a simple lab test, you can go to your family doctor or your OBGYN for that. But also other causes, are going to be menopause, autoimmune disorders. And then men or women can also get something called scarring alopecia. That's going to be people that have they also lose their eyebrow hairs, or they have hair loss in untraditional areas, like low down here, you wouldn't expect it. That's something that we can be able to identify during a consultation. But hair loss can require some workup, especially more for women. Most men are androgenic, but they can have scarring alopecias as well. Male hair loss has a very typical pattern. I think you've probably seen this on your friends and family. Early loss is going to be kind of receding right through here, and then you'll start getting some loss along the crown, and then it kind of all connects as we go along. Females lose their hair differently. It's a different pattern of hair loss. It typically starts in the midline and then slowly kind of spreads its way out. That's the most typical way with women. So they'll start talking about thinning in the middle part. Although some women post-menopausal will start noticing some frontal temporal, some recess right through here. That can certainly happen with post-menopausal. That's going to be more of a hormone-induced female pattern hair loss. We believe, or at least I believe, that the day you notice hair loss, if you've lost about 50% of your hair at that time, I believe of one thing that I'm probably more aggressive treating is hair loss for that reason. Because if we can treat it early with medical therapies to prevent you from losing it more, we can keep people with a great head of hair longer. Now, once you've lost the hair, there's no hair there, then no medical treatment is going to work. And then you're going to need a hair transplant. So I'm conservative in maybe some other treatments that I do, but when it comes to hair loss, I say when you start noticing it, let's go ahead and treat it now and treat it fairly aggressively. So there are multiple options for non-surgical treatment of hair loss. And the reason why we do non-surgical hair loss is twofold. One, you want to prevent further hair loss. And two, you can take your normal hair and you can grow it thicker to make it look better. All the treatments that I'm going to talk about, they all work. The main problem is that people don't do it regularly. You have to do these things regularly. The thing about the commitment to doing medical treatment is that you have to continue to do it for the rest of your life. It's like your teeth. If you stop brushing your teeth, you're going to get cavities and your teeth are going to fall out. As soon as you stop using these treatments for your hair, you will lose all the stuff you've gained by doing this stuff. You will lose it all in like 6 months if you stop doing this stuff. So taking care of your hair is a commitment, and you have to stay on top of it, and you can't stop doing it. And honestly, you can't stop doing it really ever if you want to have a great head of hair for the rest of your life. I've listed a bunch of these things on the screen. We're going to go over those here over the next couple of slides. So one is you can actually use a low laser light therapy cap. What this does is it's a red light therapy, and it goes on your head, and it stimulates the stem cells of your hair to grow. There's only 3 things that are approved by the FDA to stimulate hair growth. This is one of them. Now, there's lots of different types of these laser caps on the market. They're all actually really old technology. AUXO here is what I like, and it's probably the only one that's been created in the last 10 years. So it by far has the best technology. It's the nice thing about it, it only takes 10 minutes. I use it. I literally just put it on when I'm brushing my teeth. The time I'm brushing my teeth and doing I'm a facial plastic surgeon, right? So I'm doing all my face stuff. By the time I'm done with that, I'm pretty much done. But that's one great treatment. It's just daily for 10 minutes a day. You can also do injections into the hair. We use something called platelet-rich fibrin matrix. What we do is we take a little bit of blood, we spin it down, we isolate the platelets. Platelets are awesome because they go in areas that are damaged, and they release growth factors and cytokine, and they heal up an area that you've damaged. Now, if we take those same platelets and then we inject those areas in the scalp, what happens is we're causing trauma with those little injections, and it causes all of those platelets to, again, release all of those great growth factors and cytokines, and they will stimulate hair growth as well. Those injections, you typically need to do 3 or 4 of those spaced about 6 weeks apart. I love those treatments, especially for people who are noticing kind of faster hair loss, and people who have probably waited a little bit longer. They want to kind of ramp things up a little bit quicker than maybe somebody who's just starting to show early stages of hair loss. Now, this is a busy slide. You don't have to read all this, but basically comes down to 3 things that are FDA approved to prevent hair loss. They're going to be the laser light therapy cap. They're going to be Rogaine, which is minoxidil, which I think everybody's heard of. And the third thing is something called finasteride or Propecia, which I think most people have heard of. Now, this slide is all about finasteride and basically Propecia and Rogaine. Those 2 medications can be taken both orally by a pill with the mouth, or you can just use topical drops on top of your head. They will both work. So I suggest you use whichever way you're going to think you're going to use best. Pretty much all men need some level of finasteride or Propecia because male hair loss is so hormonally driven, and finasteride stops the bad testosterone, the dihydrotestosterone that causes androgenic alopecia. Minoxidil works for everybody, especially oral minoxidil works pretty darn good with women. So I really like oral minoxidil, especially for women. I think that if we can get everybody on both of these topically or orally, I'd be pretty darn happy with that. There are certainly instances where you shouldn't be on them, and we would clarify that on each individual about who would not be able to be on these 2 types of medications. Now, this is me. It's a pretty humbling picture of myself. But I started doing stuff. This is me actually today. I just took this picture 15 minutes ago, and this other picture on your left is me 2 years ago. And I've been doing lots of things over my hair over the last many years. I do the laser cap. I use topical finasteride. I use topical Rogaine as well. And I've also done the injectables, the PRFM. And with my hair, what you can see is on the left side, you can see all these tiny little hairs. These are all miniaturized. If I hadn't done anything about it, I would have lost all of this hair along through here. And by doing non-surgical treatment, I've not only maintained all of this hair in my temple area, but it's all grown thicker and healthier and forward in my temple, where I have recession up here in my frontal temple area. I would certainly describe that it is better. I honestly need a hair transplant, but at least over the last 2 years, I would describe my hair as better. I definitely have not lost more hair over the last 2 years. And same thing with my front. You can see all of this hair that's small and miniaturized. It's definitely thicker and definitely not worse. And honestly, I mean, if you look at my whole hair, if you actually look at me for the last 2 years ago, my whole hair does look better. So now, we believe the foundation is that everybody needs to be on medical therapy because we want to keep what you have. But if you get to the point like myself, where you have hair loss that you can't get back, then that's when we start considering doing a hair transplant. And the hair transplant option that I've chosen to go with is NeoGraft. NeoGraft is been around the longest. There's been more hair transplants that's been done with the NeoGraft machine. And so it's a trusted device. Now, the way this transplant works is we are taking hairs from the back part of the head and from the side. And the reason why we take these hairs is these hairs are permanent hairs. You will not lose those hairs due to the hormone changes like the androgenic alopecia that we're talking about. And what happens is that we know these are the hairs that you will lose over time. So if you take hairs that are permanent and you put in hair where you don't have permanent hairs, then that's how we transplant new hair into areas that you don't have hairs. Now, there's 2 methods to doing this, or 2 techniques. One technique is where you can make a big cut on the back part of the hair and cut out a strip of your scalp and then transplant those hairs in that nature. That is appropriate for some people. The negative part about it is that it is more painful, and it will leave a longer scar back through here, which I think is not appropriate for some people. With this NeoGraft, this is the machine where we are transplanting just those follicular units that we're talking about. It's not individual hairs. Remember, the individual hairs, they can grow in a unit of 1 to 4 hair. So we're taking out each individual follicular unit. We'll take one of them out, and then we'll make a tiny little hole where you need the hair and take that individual follicular unit and put it in the hole. And so I have a little video over here that will show a little animation that will show how the NeoGraft works.
NeoGraft was founded with the belief and dedication that persons suffering from hair loss deserve the safest and most advanced treatment available. Hair restoration should be undetectable and look absolutely natural. Traditional strip harvesting involves a large skin incision on the back of the patient's head to remove a section of scalp. This section of scalp is used as a source of follicles to be implanted in a new location of the patient's scalp. As seen in the animation, this method leaves a permanent linear scar as the 2 edges of scalp are joined together. This donor scar can be a significant source of embarrassment for patients. NeoGraft provides a minimally invasive option, leaving no linear scar. Using the same area of scalp in the back of the patient's head, a certified NeoGraft provider carefully extracts follicles individually instead of strip harvesting, and the scalp remains intact. The grafts are removed with a gentle process and collected pneumatically. Within a week, the donor area will be healed, look completely normal, and the hair will not look thinner. Once the desired quantity of follicles is collected, the NeoGraft no-touch follicle implantation method is implemented. This process involves careful placement of the follicles into the scalp area using a safe and simple delivery technique. Implantation continues until all of the harvested follicles have been transplanted. The newly transplanted follicles will rest and then regrow perfectly natural hair in the newly grafted areas. The result is a natural appearing, more full head of hair. The new hair can be colored, cut, or styled in any fashion. There is no unsightly linear scar, and the procedure is completely undetectable, other than the new hair growth, of course. For more information, visit www.neograft.com or NeoGraft was founded with.
So I think the video show will really explain this slide. But this picture is a patient, somebody from our team did do this hair transplant, but this is one where it's a frontal restoration. You can see the loss of the frontal temporal lines or recesses through here. We strengthened the hairline through here and then transplanted and thickened all through this frontal area through here as well. You know, when it comes to this trying to decide when it comes to hair transplant about when do you transplant, how much hair do you transplant, you know, how aggressively are you with hair transplants? You know, first you have to make sure you're a good candidate for it, which we'll do in the office. Like you wouldn't want to transplant somebody that has scarring alopecia or their hair loss is due to another cause. We like to stabilize somebody's hair loss. If you're having rapid hair loss, we would want to make sure we stabilize it with medical therapy beforehand. If you're younger, on the younger age, we want to start conservatively because we don't know how you're going to lose hair over time. So what we want to do is we want to do conservative hair loss, because conservative hair transplants, because the likelihood that somebody young is going to need another hair transplant later in time is pretty high. So you want to make sure that we have enough hair over time to make sure you have a great hair line for a long, long time. I think that it's more important to get the frontal looking good and important. That's going to frame the face aesthetically. This is more important. The crown of your head, you certainly can transplant, but if you're younger, you do have to be more conservative about that. I don't think transplanting the crown back through here if somebody's young is the right idea. I would probably wait till somebody's older for something like that. And some people that have advanced changes or hair loss like that, you're not going to get all that done in one session. You may need to do 2 separate hair transplants spaced about a year apart to get full coverage for something like that. This is our patient that we did. This is just showing immediately after the NeoGraft of taking the hair out. These are the little holes. I know it looks a little crazy, but you'd be amazed at 48 hours. It's almost hard to see these little holes. This picture just shows kind of the safe area of where you could take the hair out through here. You know, these are the before and after pictures. This is just a nice video of a patient that had a hair transplant.
Years ago, I was super conscious of what was going on top of my head. And now I look in the mirror 4 years later and I'm like, I don't even remember that person. I just see a full head of hair. And to me, that's awesome. So I got the NeoGraft procedure done on a Friday and I was back to work that Monday. And everything the doctor told me to expect in my recovery happened, including hair growth in just 6 months. It was amazing. I used to see pictures of myself from behind. They used to be like, who's that older guy? Now I look at the pictures, I got a smile on my face. I'm super happy with the results. So when I tell people about my NeoGraft hair transplant procedure, the question I get a lot is, well, what about the scar? And then I turn around and I show them, there is no linear scar with NeoGraft. If anyone is on the fence about getting a NeoGraft hair transplant done, I would 100% say do it. You're going to get your confidence back, which I know is a super cliche thing to say, but it is true. I came to realize you really appreciate your hair 2 times in your life. When you lose it and the day you get it back. 4 years.
So I'm gonna let Kathleen go over this section about preparing for the procedure and kind of what to expect after having a hair transplant. So Kathleen?
Awesome, thank you. So if you do decide to have a hair transplant here with us with the NeoGraft procedure, we would go in a lot more depth. I'd go over a lot more, but I'm just kind of keep it quick, simple, and hit the high notes. These are a lot of the questions I get pretty frequently, and the really important things. So most importantly for a hair transplant is to stop smoking or nicotine of any kind. Your head is such a vascular area and nicotine really affects that. So that would be something we would really want at least 6 weeks out. And then hopefully you stop for forever, but at least 6 weeks out, and then we would talk. 10 days before, we would get you off of your aspirin and anything else that could contribute to any excessive bleeding during the procedure. This is to protect yourself and to your little grafts and to make sure that we get the best result. 3 days ahead of time, we would stop our topicals. We want you to use all of that's your minoxidil, your finasteride, that kind of stuff on your hair. And so at 8 days after the procedure, we would tell you, go ahead, start using that minoxidil again. And then beforehand, we would call you in some prescriptions. And I always like my patients to pick those prescriptions up a couple days ahead of time, just in case there's an issue with the prescriptions or the pharmacy. So you're not trying to rush the morning of your procedure or at 7 o'clock at night, the night before. And then for our male patients, we like a day or two, we like you to go to a barber of your choice, whoever you want. We have some wonderful ones we can recommend, but to kind of on the back of your head where you've seen that picture of the safe donor area, we want you to shave that kind of like a short, high and tight military style haircut. Once day of procedure, we will give you an extra little trim, but we found out that if you already go and have a nice fade, it just is a nice better result for you as your hair continues to grow out after the procedure. It looks more natural. So we're happy with that. And then the morning of the procedure, we want you to come in. Like I said, Dr. Kulbersh will have prescribed some medications, so you'll bring all those with you. But I want you to eat and have a good meal on your stomach so those medications don't make you sick. Because you are taking medications, you're not going to be able to drive yourself home. So you would also need to make sure you have someone that's there that can drive you home after the procedure. They don't have to hang out the whole day. They're more than welcome to go and do whatever they want, but just to be available when we're finished. That morning, I want you to shower with just an over-the-counter antibacterial soap, get you nice and clean and ready, and nice clean for your procedure to reduce the risk of infection or anything like that. And because we've got you nice and clean, I want you to stay away from any lotions or any other hair grooming products on your head and your neck. Just for the day, right? And then it's a long day. You're going to be laying face down for the first portion while we take those grafts out of the back of your head. And then you're going to be sitting up during the implantation of the grafts. So I want you in something comfortable, sweatpants, you know, something easy, loose, comfortable, and a button-up shirt or a zip-up jacket, but nothing that would be pulled over the head. And I want you to comfortable clothes like that for a couple of days because we really, really, really want to protect those grafts. And we don't want to risk pulling something over your head and knocking your new grafts out because we're really excited for them and we want to keep them and save as many of them as we can. So this is a picture of our patient that we did recently, and the picture on the, well, you can see from the front is where we implanted those follicular units. And then of course, everyone wants to know what's that thing on his forehead. So that's a steri strip, and we place that on the front of your forehead because swelling is a natural and expected result of the procedure. So that steri strip on the forehead kind of encourages the swelling to kind of go off the side of your face and not down over your eyes, which we all appreciate. The back of his head is the donor area that was taken immediately that day afterwards. So it kind of looks a little funny, but we've got some more pictures. You'll see how quickly and how beautifully it grows in. So this is our patient immediately after surgery. I wanted to get a picture to show what a great mood he's in, because it's really a great procedure since you are awake during this procedure.
How you feeling, Charlton?
Lovely.
Did it hurt?
Not a bit.
Love it. How you feeling, Charlton?
So I like to show that video, because he's feeling a lot better than most of us probably are right now. And that's immediately after the procedure. So this photo now is the patient a week later. You can see the front. Those areas are nice and scabbed over, and that's exactly how they're supposed to look. And we want them to look like that. Those scabs will last, up to 2 weeks, but at the 1 week mark, you are able to really kind of get conditioner and carefully kind of wash and massage those scabs off. The picture on the right, I mean, that looks like a totally different head. I love this picture. It just shows how beautifully and quickly the back of the head heals. And it's just a great illustration of how simple and quick and easy the recovery really is from this procedure. And then during the patient, I kind of talked about it. You're on your stomach for the beginning, and then we would break for lunch. We ask our patients, hey, what do you want to eat? We'll order whatever you want. You want, pizza, we'll get pizza. You want pasta, whatever. So that's fun. And of course, it gives the patient a chance to stand up, stretch, use the bathroom if they need to. If they need to make a phone call, that's totally fine. And then during the procedure itself, we have a TV in the OR. They can watch TV. If you want to listen to music, well, you may have to hear us sing along. And then of course, if you wanted an audiobook or something like that, it's really up to the patient and whatever they're comfortable with. And so these the day of the recovery, this is super, super important for all my patients. You'll hear me say this 100 times. Do not touch this transplanted area. These follicles are really, really fragile for the first couple of days. So we just really do not touch, do not touch, do not touch. Of course, I hit on this earlier. You've taken some medication, so no driving a car. That's why we have our driver. And then we here at Carolina Facial Plastics, we are a big believer of nutrition. So we want you to eat. We want you to have a good diet. We want you to have calories and protein to start the healing process. And so we really encourage our patients to have good food during, for lunch, and then that night for dinner. And then it's totally normal. The back of the head, you saw those pictures. It is, kind of oozy back there. That's normal. I don't like that. I like to be upfront and honest. I don't want that to scare anyone. And so I'm a big believer of saying, yeah, you're going to have some oozing back there. Maybe put a towel over your pillowcase or something like that. The other thing, we send all of our patients home with a spray bottle of saline, and they'll just start spritzing their hair kind of up front with the saline solution. Like I said, we give that to you. We'll go a lot more into detail about that. And the other thing to note, day of recovery in the first couple of days, we want you to sleep elevated. You don't have to sit straighting up like I am now, but a couple pillows, probably 3 pillows behind your head and on your back. So again, we're not damaging or doing anything to these new, fresh, transplanted grafts. So these are the big milestones. This is the stuff everyone asks me when they have a hair transplant. Well, when can I wash my hair? 2 days. I want you to wait at least 2 days to wash your hair, and I will with you go over instructions on how to actually wash your hair. And then I put no sweating for 2 weeks, because everyone's version of exercise is a little different. But really, nothing that's going to make you work up a sweat for 2 weeks. In 4 days, you can start wearing a really loose hat. We have some surgical caps we can give to our patients. Otherwise, you can wear, something up off the head. At 10 days, you can brush your hair normally, which is fun. At 14 days, you can resume your normal physical activity, and we want to protect that scalp, that fresh area. So we advise you to use spray sunscreen if you're going to be out in the sun. Like I've talked about earlier, those little scabs you saw at the 1 week mark, at 2 weeks, we expect those scabs to pretty much be all gone. And if not, we'll help you and encourage you to kind of, with conditioner, work those scabs off. For the first 4 weeks, stay out of swimming pools or anything like that. You don't want to really submerge your head in water. Showers are fine, but not really to submerge. And then everyone wants to know, when can I dye my hair? 8 weeks minimum before you dye your hair again. And then we'll go more into depth about that when you come to see us. Other normal complications, not complications, expectations of a hair transplant is at the front of your head and the back of your head can have some slight redness or discoloration. That's completely normal. We expect that, and that's okay. And it will get better with time. Every patient is different. That timeline is different. I can't say, oh, for you, it's going to be 3 weeks. And for you, it's just patient specific. Same thing with numbness. A lot of times when you take those grafts out of the back of the head, you can have some numbness in some areas, and that will resolve with time as well. Some patients do develop some pimple-like bumps. If that happens, call us. We'll work through it. It's not a big deal, and we'll take care of it. But that is something that can happen. And the thing that is the most important to warn everyone is all of those transplanted hairs that we put up here, they will fall out between 2 and 8 weeks. We expect that. That is normal, and that is nothing to freak out about. That it's shedding of the hair, but the graft itself is stuck, and it will go through the growth phase. And it will take probably 4 to 6 months is what we realistically say. So don't panic with that. And then the estimated timeline after your hair transplant, day 5, we think those grafts are pretty well firm and set in your head. So we're pretty happy with that, but we're still going to be careful for that day 7 to 14. That's when those transplanted hair started to shed, the scabs are starting to fall off, we're starting to look good, you're back in your normal daily routine, so we're really happy. 3 to 4 months, you might start to see a little bit of a growth there, which is exciting. At 6 months, you're going to 50% of those hairs are really starting to grow. So we're really pumped. At 12 months, almost 90% of that hair has started to grow, and we can really truly see, you know, how good it's going to look and how awesome. But at 1.5 to 2 years is when you really get your final result. And of course, all of these timelines vary patient to patient. But yeah, so that's kind of the quick and easy of the NeoGraft beginning to end kind of expectations for that.
Thank you.
Yeah.
These are just some before and afters of some members of our team of some of their hair transplants that they've done. Again, this is strengthening the frontal temporal area, strengthening the front long of the hairline, which I think is most important. And then first, want to thank everybody for taking your time. A little bit about how the consultation process works. If you're interested and you want to come in, you want to learn more about your options, Kathleen and I both see consultations. If your main concern is non-surgical in nature, I would recommend that you make a consultation with Kathleen. Not only can she guide you, but she will also do the treatments if you decide to have PRP injections or PRFM or exosomes or things of that nature. If you're considering having a NeoGraft or a hair transplant procedure, then the consultation would be with myself and Kathleen. Some people I know aren't local, so if you need to have a virtual consultation, we certainly can do that. So we do it the same way you do it over Zoom. We do that very commonly for people who are out of town. That's even for non-surgical stuff. We can mail you all the different items that you may need if you want to do, you know, drops or pills or laser caps or things of that nature. But Kathleen and I are both passionate about this. We're both, you know, equally dedicated to hair restoration. And again, just we feel honored that everybody stayed on the webinar and listened to us talk for a little while.
Yes.
Amazing. Thank you guys so much. If you can just go to the next slide before we get into the Q&A. I just want everyone to see, just in case you're not familiar with where to find us, if you want to take a little screenshot, I'm going to pull this down in a second, but you should all follow us on Instagram. We have a great page. All right, so now is the time to submit any of your questions that you may have, and we'll get to as many as we can. But before we get into that, thank you, Dr. Kulbersh and Kathleen. That was great. I learned a lot, and I hope everyone else here did as well. All right, so we have a couple questions already. Oh, this is a great one. I should have asked this myself. Can we see the hair cap?
Yes, I have one. Let me grab it.
We talked about this before we went live, that it would be good to see what it really looks like. This thing's very cool. I know. All right. Suspense is building. You can show us what the big box looks like when someone purchases it. Okay, well, here's the cap.
So it's actually not a bad looking cap. My kids find this really entertaining as I'm walking around with this thing on. It's bright red, and especially at night, you look like you're glowing. But I'm gonna let Kathleen try it on because she's never tried it on before. Go for it.
Yeah,
All
Kathleen obviously needs lots of extra
And
hair.
you literally just put it right on, and then are you turning?
Ooh,
You can see it kind of is nice and red in there. So this hat, like you said, you just click the on button, you wear it around for 10 minutes, do your brush your teeth, chat on the phone, scroll Instagram or TikTok, right? Whatever your routine is. You can do this at bedtime, you can do this in the morning, you can do this in the middle of the day. The important thing is that you just wear it every single day. 10 minutes. Our patients that are doing the topical medications also, I tell all of them, use your topical medications, get them on there, then get your hat, put it on, and that only helps those topical medications work more. So it's a great little add-on to your thing. It's your cap. You get to take it home. You can take it on vacation. If your husband has it, you can wear it too. You don't need two for the same home, right? So it's just a great cap, but it is really fun. And so
thank you for turning it on and showing us.
of course, you just charge it in the back, but you can walk around with it. You're mobile. You're not stuck to one spot. But yeah, it's a great little hat.
Very cool. And I could see that being funny at night when it's dark out with little boys. All right. So what is the starter dose of oral minoxidil that you suggest for a woman with hair loss?
Yeah, so 2.5 milligrams. Oral minoxidil, if the things I wouldn't suggest it for anybody who have a significant cardiac history. So any sort of, you have like a history of like a heart attack or whatever, you have a history of really low blood pressure, maybe not the best thing, because minoxidil was originally admitted as a blood pressure medication. And so it has the potential of lowering your blood pressure. So we start low, and then if patients tolerate it well, then, we can go up on the dose.
All right. So, so just to clarify, can you wear this red cap in conjunction with the topicals?
I'm encouraged to do it. So like I said, you're going to put the topicals on. And the important thing with topical medications is the application of it. So if I took topical and I just smeared it on my head, I'm not going to get any result because the hair is not where I'm trying to put it on. You want to part the hair, really work it into the scalp, right? Pull your hair back, work it in there. And so you're kind of massaging it in there kind of slowly. Once you feel like you've got it in there nice, then you could take your cap, put your cap right on and wear your cap for 10 minutes. So I highly encourage, if you're on topicals, to do that and then put the cap on. Yeah, great question.
Yeah, the cap is really cool. I remember, wasn't it like a decade or two ago where you had to go sit in an office every day under one, like almost like you're in the hair salon. Like
yeah, the cap is awesome because once you purchase it, it is yours and you can take it wherever. I think this is an important piece to mention also with the cap. We all know with technology, the first thing that's going to go out on something is the battery. So the battery of this cap is at a really, really affordable price point. A replacement battery is $50. So I think that's important.
No. And are all hair caps created equal? I bet there's like a million knockoffs of this online.
Yes.
Yeah, so we did a lot of research in and did a lot of research, a bunch of different caps and a lot of experts in the field. And like we said, a lot of the other cap, the technology is 10 years old. I mean, this is the only cap that's come out in the last year or two. I mean, I think technologically wise, it's the best.
Absolutely. And it's really cool because red light therapy has been around for a long time. And I feel like the longer it's around, the more we're understanding this technology and the benefits of red light therapy. And so to kind of hone it in and to incorporate that into hair loss, I think is an awesome thing.
Yeah, I love that. All right. Here is a good question. So I'm out of town, but I have a pre-op appointment for my eye surgery. Can I also talk to you about hair options at that time?
Sure. Yes.
Yes.
Absolutely. All right.
So with that, just email Lisa and just let whoever got the pre-op appointment, just email Lisa and tell her that you'd like to talk about hair at that appointment, and just so we schedule enough time to make that happen.
Good idea. All right. Few more questions here and then we'll get to our drawing. So how long does a hair transplant last? And does the hair always keep growing in that area?
Yeah, so the whole premise behind a hair transplant is that you're taking hair that will be permanent and you're taking it and you're moving it into another area. So yes, a hair transplant is permanent. Now, yes, over your lifetime, over 30 to 40 years, will you lose some of the hairs? Yes, likelihood that you will have some thinning, but it is supposed to be permanent. Was there a second part to that question?
Does the hair always keep growing in that same area?
Yes, yeah. So it grows just like, so if you take hair from here and you move it here, it's going to grow just like this hair would, for the same ways that hair is going to grow for the rest of your life.
Yeah, and something to add to that point too, if you have a hair transplant, that means you still have to do the other stuff. If we transplant hair here and we know that you are naturally losing your hair receding backwards, you would still want to continue on with some of the non-surgical medical management hair, because this, like he said, this is going to be permanent hair. And it will look kind of silly if you don't take care of the hair behind your new permanent hair. So you get your new hair and you have to take care of the hair behind it as well. Just because we want everyone to look good. Our goal is our patients look great in 10 years, 15 years, 20 years down the road. We want our patients to look natural, and we want you to still look good, and we want your hair to be beautiful, to age with you.
Perfect. And, I know we spoke about men and women, but in general, are these treatments better for a man or a woman, or is it?
The transplant?
Mm-hmm.
No, I mean, they're equally good. I mean, I think that your concern of hair loss is no different if you're a woman or a man. I think it can be distressing or upsetting, both for men and women. I think some may argue it's more distressing for women. I mean, I don't know, but I think it's probably an under-recognized thing with women. I think men talk about it a lot more. If you ask aesthetically speaking with men, they will say hair is their #1 aesthetic concern. If you talk about women, they may not say that nationwide, but it's probably, yeah. But no, it's a great option for really men and women.
That's great. All right. So I think we have gotten through all the questions. I have one more and then we'll get to the drawing. How would this work if someone wanted to visit and get the hair loss NeoGraft from out of town? Is that possible?
Absolutely. So lots of patients travel after having NeoGraft. Realistically, I'd like the patients to stay in town 1 to 2 nights, right? Come in the night before, let us the night before the procedure. We'd bring you into the office, we'd look at everything, we'd draw, we'd make sure you have medications, make sure all of that's set. The next day, like I said, you'd have your breakfast, you'd come in, you'd bring your medications, take all that, hang out, spend one more night here in town, and then the next day we like to see our patients back one day afterwards, just because it's a lot of information and nerves going into these procedures. And I find if you see patients the next day, you can talk about, okay, we've done the procedure, the nerves are out of the way, here's what we need to do now. And then you kind of re-hit that follow-up and post-procedure instructions and really guide patients and all of that. From that point, patients are more than welcome and encouraged to go back to home, wherever that is. And if they want to see us again, we could do a virtual follow-up as easy as any other surgical follow-up. You know, hop on a Zoom call. I can talk to you.
Yeah, we do utilize technology follow-ups with all of our patients out of town. So we would definitely follow up with people virtually with the same thing, a Zoom call or a FaceTime during the recovery process.
Awesome. Okay. All right. So are you guys ready for the winners? I have popped everyone's name into a little random picker here. So, I guess, psych, for a reminder of what you are receiving. First of all, everyone in here is a winner because everyone is eligible for a complimentary consultation for hair loss, and that's a $300 value. So all of you are welcome to call the office and get that scheduled as soon as possible. And why not? Even if you're not ready to have a treatment yet, I think it would be great to do a consultation. And, you know, I think Kathleen could even tell you how much hair loss you're experiencing so far and how far, because like they said, oftentimes, you know, we don't think it's so much hair, but then Kathleen gets in there and it's a little bit of a different story. But 3 lucky winners are going to receive 40% off of a hair loss treatment or a hair loss product of your choice. So that could theoretically be quite a good discount. So are we ready? Now drum roll. The first winner is Natasha. And I will not say last names, we'll notify you. But Natasha, congratulations. Number 2 winner is Scott. And last but definitely not least, we have Lori. So congratulations to the 3 winners. But thank you all so much for tuning in. We're really excited about, you know, sharing NeoGraft and all the hair loss treatment options with you all. And hopefully you all learned a little bit. And thank you so much, Dr. Kulbersh and Kathleen, for your time. I know you saw a lot of patients today and you've been really busy. So I appreciate you staying late to help educate us all. And otherwise, everyone, please follow us on social media on Instagram and make sure to call the office tomorrow and make your appointment for your complimentary consultation. And we'll be sending out the recording this weekend if you want to forward it to anyone else who it may help. So thank you again, Dr. Kulbersh.
Thanks, everybody. Thanks, Risa.
Bye.
Bye.